This year, we celebrate Social Security Week 2015 under the theme Health, Safety, and Social Security as Shared Responsibility. The focus of my presentation will be on safety and health in the workplace. The theme, in my opinion, is quite timely and relevant given the grim report from the ILO on health and safety at work. The ILO estimated that globally 2.3 million persons die from work-related accidents and diseases each year. Additionally, 250 million workers suffer non-fatal injuries, while 160 million workers fall ill for shorter or longer periods. These workplace-related deaths and injuries can result in economic hardship for many countries. The ILO further estimated that the total cost of such accidents and work-related illnesses amount to approximately $2.3 trillion on global economies annually. It is to note that a large portion of these costs are borne by governments and social security systems. In Anguilla, the lack of proper data does not give us a true picture of our own situation. However, to my recollection, we have 2 deaths recorded from accidents on the job during the past 10 years. Notwithstanding this fact, the record of the Social Security Board will show that a high percentage of disability payments to workers were due to workplace accidents and injuries. So what do we do? What are the direct and indirect consequences when accidents and work-related injuries occur in the workplace? The consequences of accidents at work can negatively impact not only the victims and workers, but also their families, the companies, and society as a whole. For the victims who have been injured on the job, they incur pain and suffering, as well as loss of salary and high medical bills. Family and friends have to deal with moral and psychological suffering and financial loss, which is even greater if the victims were the breadwinners for the family. The company subsequently has to alter its operation for absenteeism, training of new staff, legal sanctions, and decreased production. Society as a whole is also impacted, resulting in reduction of the quality of life for families, loss of production, early retirement, and increased Social Security costs. The impact on Social Security is twofold. The worker who became ill because of accident on the job will no longer be able to make contributions to the Social Security system during this time. Additionally, Social Security have to provide sickness benefits to that employee. So what can be done to help to remedy this situation going forward? In my opinion, all stakeholders need to help to build a culture of prevention on occupational health and safety in the workplace. Each and every one of us must contribute to prevent occupational deaths, injuries, and diseases in the workplace. It is a shared responsibility. A national culture of prevention entails 1, respecting the rights of a safe and healthy working environment at all levels. 2, employers must ensure that effective and all-inclusive health and safety programs are implemented at their establishments. 3, workers have to also take preventive actions to ensure that the health and safety at work is also protected. By doing so, they will ensure that management become conscious, and management also know that they are vigilant in this endeavor. 4, it is also time for government to create policies and enact new laws on health and safety in the workplace. As chairman of the Social Security Board, I will endeavor to ensure that we play a proactive and major role in this initiative. We will facilitate discourse among all stakeholders to promote consensus building for the implementation of effective national occupational health and safety policies and updated laws for Anguilla. In other words, I am calling for urgent action to create a preventative culture of occupational health and safety in the workplace to reduce and to eliminate the pain, suffering, and financial burden on victims, their families, employers, government, and the Social Security Board. So as we celebrate Social Security Week this year, let us look at the bigger picture and join together to implement adequate health and safety programs in the workplace. Thank you.